Right, so this next video will be going through the most common injections we use of the hand. So I won't actually be injecting this, we're just going to be using a needle with a safety tube on and just going through the technique. So the first one we look at is the inferior radioulnar joint. So what we're going to do here is we're going to go down to the inferior radioulnar joint, which is there. We're going to mark the lid. So here's one I prepared earlier. So there, mark it with a lid. Alcohol wipe, give it a clean. And then we are basically going straight down like that. Second one is injection of the wrist. So here we find the dip. So we are just coming down from the fingers, and then we've got the dip in the carpus bones. Mark it, clean it, and then straight down like that. Also, it's useful for TFCC problems, so patients that have ulnar-sided wrist pain. So there's two ways of doing this. We can go horizontally and vertically. So vertically is you are going to find the ulnar styloid process, and then we are just coming just slightly distal and slightly medial to it. So it's there. We mark it again, clean it. The vertical or the horizontal, I generally go down on the vertical side, or doing it vertical. Another one I do quite a few of is the Quervains. So obviously, as you know, it's the irritation in the first dorsal compartment, and it's between abductor pollicis longus, extensor pollicis brevis. So what you can do there is I generally put the finger in slight flexion, the thumb, sorry. You're coming down, you can feel the tendon. You can put it in slight flexion, the wrist in slight ulnar deviation, and you can actually feel the tendon. So we mark it. So it's like that. Clean it. Orange needle. This time we're going in obliquely, and as you put the injection in, you generally see a little bit of a bulge in that area, and as you're injecting, you're pulling out, so you've got plenty of room to do it. And then that's that one done. The next one is the MCP joint. So using an orange needle, we are going to find the area. So for example, if we are looking here and palpating the MCP joint, we're not going to go straight in, we're going to go oblique at an angle. So we palpate, mark. We are not using a blue needle for this, I'm just marking it, clean, and then it's with an orange needle, and you're going slightly oblique, so you're not going into the extensor tendon. And another common one is for first CMC OA. So you are going to first of all mark the joint. So I come down, and you can feel it just, if I just move the hand ever so slightly. So we're coming down, not into the snuff box, because that's just slightly too low. And there it is. And then we mark it. So you're not in the snuff box, and then orange needle, once you've cleaned it, straight down. Another most common one we look at is trigger finger. So you get triggering around the A1 at the A1 pulley. So what I generally do, I'll palpate the A1 pulley, and if it's painful, we mark it. So again, we're using a lid, clean it, and then the books and the literature have two different ways. One talks about oblique, sort of either way, or straight down. There's another one, as long as you be careful about where you're injecting in the tendons. So the final one that I use is obviously the carpal tunnel. So what you can do here is you are looking at the creases of the wrist, and you go for the middle in between the most distal crease and the middle crease. So we mark it, clean it, and then this time we are going like that, and be careful not to hit the nerve. So if you do hit the nerve, they'll start to complain of the symptoms in the hand, so then pull back slightly, but that's generally the way you do it. So you look at the in between the middle and the distal crease, and you inject like that. So you're not going like this, it's like that, and you're not going like that because you're too far down. So it's there, and that's it.